Hi, everyone. Happy Wednesday. I'm Dr. Carolyn Alexander in Los Angeles at Southern California Reproductive Center. I'm honored and privileged to have Sally with me today, and she's inspired me and encouraged us. And so I think it's such a wonderful moment to have this podcast together, and I'd love for you to introduce yourself.
Hi, everyone. My name is Sally Hayes, and I am the founder of Matrikas, and we are a community of fertility, pregnancy, and postpartum providers. And we work together to make sure that we have collaborative care for everyone's patients and clients so that no one slips through the crack with their care.
Wonderful. I was born and raised in LA. I went to UCLA and then I lived for quite some time in Baltimore working and doing my training at Johns Hopkins Hospital. And then I came back and worked in academic medicine at Cedars-Sinai. And now I've been here at working in our embryology lab, I can't believe, for 19 years. But it's an honor to take care of patients on their fertility journey, talk about important topics and health overall for both partners. And I think it's near and dear to me as an older parent. So I feel like this is an important thing to think about and to feel supported through the journey. So I always, you know, put a lot of heart into every step of the way. So, um, did you want to say anything else, Sally? Tell us a bit about yourself.
Yeah, so my background is actually I was a pre and postnatal massage therapist, and then also started working with fertility clients towards the end as well. And that is actually how I started Matrikas. It was a happy accident. I worked with plenty of clients who needed practitioners, and I would reach out and try and find practitioners on their behalf to make sure that we were handing everyone off very easily. So thankfully, I was in Los Angeles for many, many years, and I got to meet wonderful doctors like Dr. A at SCRC and many providers, even prenatal yoga instructors, just the entire spectrum. And every time I reached out to another provider, they said, we actually need referrals as well. And we have clients who are looking for people. So that is how Matrikas got started, and I'm very fortunate to work with very wonderful providers throughout the US. And we have a directory. So if anyone is looking for um, any support on the spectrum fertility through postpartum, we probably have one of your providers for you.
That's wonderful. That's so inspirational. So, next slide. At SCRC, we've been here for a long time. Our lab started in 1999. We're blessed to have frozen eggs that have been thawed from 15 years ago and made a healthy baby, which is a triumphant success for us. And we have a state-of-the-art embryology lab, an on-site surgery center. We have our main hub in Beverly Hills, but we also have a full embryology lab and clinic in Santa Barbara. We have satellite offices in Pasadena and Ventura, and we did have one in Burbank as well. And we have amazing doctors in our group, Dr. Suri, Dr. Dancer, Dr. Maxwell, and Dr. Chavkin. And so we're all dedicated to helping patients along their journey. And we work really closely together. We have an ethics committee. We talk a lot about complex cases and try to put our heads together. So I feel like it's such a fun working environment here. And our staff, one of our staff members has been here for over 29 years, which is exciting. Next slide. In terms of our lab, we have experienced and certified directors, double witnessing verification. We have do something called vitrification or flash freeze, which is how we freeze eggs and embryos. We do the blastocyst biopsy, which is called pre-implantation genetic testing for aneuploidy screening, as well as for monogenic gene disorders such as cystic fibrosis, Tay-Sachs, thalassemia, sometimes for BRCA1 or 2, sometimes also for early Alzheimer genes, specific genes that you or you may carry or run in your family, we can check for. We look at morphokinetics on the embryoscope, which is a really fascinating view of the embryo developing over 7 days. It's 1,000 data points, and we can differentiate which of the embryos might be a little better than the other. And so the morphokinetics has added a bit of interesting information. It won't change the destiny of genetics, but it will help us differentiate between the embryos. Next slide. Today, we're going to focus on Fertility 101, which I always say it's really important to understand our body, understand that the menstrual cycle is the fifth vital sign. It's one of the important vital signs. So sometimes when patients come in and say, I haven't been getting my period regularly, I say, let's get to the bottom of it because it's an important vital sign. We'll look at diagnosis and testing. We'll look at optimization for fertility and treatment, our support network, which I think is really, really important, building your community. We'll talk about our team and any questions as well. Next slide. So I'm again Dr. Carolyn Alexander. So Fertility 101, fertility issues are based on multiple factors, including both partners could have a fertility issue, age, family history, lifestyle modifications, weight, as well as also how much we're exercising, sleep disturbances, making sure to take time to eat a healthy diet instead of processed foods as well. But nutrition's over 7 days, so you don't have to feel bad if you ate a lot over the weekend. You can try to improve that over the 7-day week and try to think of it that way. Next slide. So what is infertility? So under age 35, it's trying to conceive for 1 year with regular periods with unprotected intercourse. Some patients by accident are using spermaticidal lubricants such as non-oxyl 9 or some lubricants that could be compromising the sperm. So it's really looking at a lot of different factors with 1 year of unprotected intercourse. When we're over 35, it's important to have a conversation with your OBGYN or think about talking to a reproductive endocrinologist if you've had consistent unprotected intercourse around the time of ovulation for 6 months. A lot of people say, when is my perfect window to have unprotected intercourse? When I'm really eager and trying to get pregnant. Some patients check home urine LH kits. Some people like to do a lot of the kits that they can detect urine or your basal body temperature. It's important to recognize that if your period's 28 days apart, most people are ovulating around day 14, but we really want to encourage unprotected intercourse around day 10 or 9 and earlier. And if your periods are 25 days apart, you really have to start to have unprotected intercourse a little bit earlier as well, because you would be ovulating a bit earlier in the cycle than the average age. I find this fascinating, but the month-to-month chance of conception, really when we're younger, it is into our 22%. And then as age and times goes by, it's around 18%. And then once you've been trying for a year, the month-to-month variability is around 9 or 10% per try without intervention or medications or us trying to improve the odds. So it's important to know that even though it's a perfect ovulation, perfect unprotected intercourse, you feel like you're healthy and your doctor has done all the checks to see your hormones and things like that, and then it feels, and I know how it feels to have been trying and then you feel like why is it not occurring? So it's important to talk it out and try to understand. The next slide is important too. It's called age factor. I know for myself, I felt like I can't be 39 already. Like I felt like time went by and I was so focused on work and my career. So I understand when patients tell me that. But in general, as time, when we turn 35, the chromosomes in the eggs start to get sticky. Those eggs have been in us since we were a baby. And so, as you can imagine, the genetics and the ability of the mitotic spindle to separate the chromosomes properly starts to get a little compromised as women, when we hit 35. In men, we do see some changes in dynamics of sperm when they turn 45, but also especially around 50. And it's important for men to prepare for 2 months or more with lifestyle modifications before they want to try to get pregnant. As women, we try to say 3 months, but really it's a lifetime of exposures that makes a difference. And so it's important to think about that. Next slide. Patient evaluation. So we look at the medical history. So if you have type 2 diabetes, chronic hypertension, rheumatoid arthritis, lupus, any kidney disease, you want to get as healthy and prepared as possible before pregnancy, because some of the medications may be influencing the ability of early embryo development. So like today I saw a patient with chronic hypertension who was on 2 medications that are not allowed in pregnancy, and she was so happy because we're going to switch those and talk to her primary care doctor and get it. And then I asked for a morning and afternoon blood pressure for a week so that I get a sense what is her blood pressure doing, because that has ramifications during pregnancy for risk also of preeclampsia, placenta development, and a lot of risks for a smaller baby or IUGR. So there's a lot of things we can do to protect the pregnancy to be as healthy as possible. You want to get your physical exam. So remember, I even encourage the male partners, please get your annual physical exam. Some patients, if they have a strong family history of melanoma, need their annual skin check. We want to make sure if you're at the age to consider a breast ultrasound or mammogram. It's important to keep up to date with your pap smear as well, because in pregnancy, the cervix, the ectropion, gets more exposed. And so it's important to make sure you have an up-to-date pap smear. If you have any cardiovascular risk or strong family history, to get an EKG or an echo as well. And then diagnostic tests are very important. We want to understand, are the fallopian tubes open? Is the shape of the uterus a typical triangle type shape, or is there a septum or any abnormality in the uterus? Some people can have a fibroid, which is a benign little muscle tumor, but it can pinch in where a baby would grow. And if that could get fixed or shaved down, it might be less risk of miscarriage, and especially polyps, or if you've had any prior surgical intervention in the uterus, to check for any scar tissue as well. Next slide. AMH is called anti-Müllerian hormone level. It's produced by the cells around the egg, or the granulosa cells. And we want it in general above 1.5 or 1. And as you can see, age 26 to 29, normal is 1.9 to 5.8. 30 to 35 is 1.4 to 4.2. 36 to 39, 0.84 to 2.8. 40 to 44.42 to 1.4, and then above 44, it typically starts to go down, but we do see some patients who have a higher AMH and they may have a better egg supply. The image on the right is the ultrasound, which each little black circle has a potential egg. The egg is microscopic and sits in that circle. That's called a follicle. The follicle has fluid that's influenced by nutrition, cortisol, which is like our stress hormone. So I do have to have some conversations with some patients who are really anxious, really stressed out, in terms of meditation, mindfulness, trying to understand. It feels like, why can't I control everything? Because we want to be able to control everything, but we have to take the test step by step and try to understand and fine tune the treatment plan to your specific needs, and to understand your partner. And it's hard for us in some cases where if the partner is on medication or taking doing lifestyle things that we feel strongly, but we have to ease them into improving it. And I try to show them pictures of sperm and say, we do see a lot of improvement on that if they could improve their lifestyle modifications. Next slide. So what is an HSG, or hysterosalpingogram? Having had it done, it is pretty painful. So I just want to warn you, it feels like a super bad cramp. It's a relatively brief test. but it's a thin catheter that goes into the cervix. And then you can see here the uterus outline. It's a shadow. This is an X-ray. And this is an open fallopian tube on the patient's right, but our left. And then on the right, on the left here, you see that the tube is spilling the dye. Sometimes we do see a swollen tube or a hydrosalpinx. Sometimes we can see little out pouches, which is isthmica nodosum. And sometimes we do see one tube is closed and one's open. That can be spasm, so it's not necessarily for sure closed. This test positive prediction is around 80%. So sometimes patients can have a spasm on both sides, and we say we don't know if the tubes are open, they could be closed. The little gray circle in the triangle is called a possible polyp, and it looks like a little circle in the white triangle area. And that area needs to get fixed because it has a tissue that's not healthy for us. And it's important, even when we're not trying to get pregnant, that we look into that, because sometimes in the middle of a polyp can have some bad cells. Next slide. What is the semen analysis? So you want to ejaculate 2 to 5 days before your appointment day. We want the volume over 2 milliliters, the count or concentration over 20 million per milliliter, the motility over 50%, and the morphology, depending if it's World Health Organization or Kruger, there's different criteria for the shape, which I think is cool to look on the right, but the normal shape of a sperm has the head, mid-piece, and tail. And on the right, there are abnormal forms, which are a giant head, a small sperm, a tapered head, double head, double tail. And so studies indicate that 25% of infertility is primarily male factor, whereas 40 to 6% is a combo of male and sperm, and female. Next slide. So it's important to avoid toxins, like I mentioned, in terms of alcohol, marijuana, tobacco. I think it's always, I tell patients we can't look at the past, because sometimes people are like, what? I wish I knew, or I wish I did things changed earlier. But even in life, it's a journey. So you can only do what you figure out at the time. And so it's important to not have too much alcohol, especially hard alcohol. Marijuana may have an impact on our hypothalamic pituitary ovarian axis, which I call like the main trigger signals for us to ovulate. And especially in men, sometimes their libido can go down. They can get gynecomastia. Some men can feel like their testosterone may not be as strong. So there are some ramifications with cannabis, though I do understand that a lot of men tell me, but I can sleep better. I feel less anxious. I feel like it was a magic bullet versus medication. So we hear everything. So it's fine-tuned to your situation, and it's a discussion. Tobacco definitely does change our egg supply and make us potentially have earlier menopause. And then also with tobacco, it changes the ability of the fallopian tube to peristalse to catch the egg. And so we see higher risk of ectopic pregnancy in women who smoke. We also see that the AMH can be lower and higher risk of miscarriage. In men who smoke, we see lower motility, as well as sometimes the sperm quality and DNA fragmentation can be hindered. Next slide. It's really, really important to take a prenatal vitamin, especially folic acid, 3 months before you start to try to get pregnant. Folic acid can impact spina bifida, which is the development of the spine in the baby. So it's important to also keep your vitamin D level 30 to 50. We see better outcomes in pregnancy. You want to be avoiding anemia. You want to also make sure to think about CoQ10, which improves the energy of the eggs, or the mitochondrial function of the egg. And in women who are trying to get pregnant, when we do an embryo transfer, if we can get their vitamin D level better, we see better implantation rate of the embryo. Next slide. So a lot of people ask me, what should I eat? I want to understand all the tips. Well, Mediterranean diet's really a good tip. I think Folic acids in legumes, asparagus, dark leafy vegetables. B12 is very important too. Omega-3 fatty acids, but we do have to be careful with mercury, but everything in moderation. With men, we're encouraging them to eat more walnuts. If they're allergic, they can do quinoa and other ways of getting omega-rich foods and B-rich foods. And then avoiding heat to the testicles, avoiding artificial sweeteners for both partners, and avoiding hard alcohol. Next slide. So in terms of the treatment plan, it's very dependent on your egg supply, your egg quality, your age, whether your fallopian tubes are open, and whether the semen analysis looks reassuring. Sometimes we also test a sperm DNA fragmentation. So it's very tailored to your specific data. Next slide. So there's assisted reproductive technology where we do in vitro fertilization or IVF. There's the embryo transfer process. There's the blastocyst transfer, pre-implantation genetic diagnosis, sperm retrieval. Some men may have issues where they can't, in the ejaculate, there's no sperm. So sometimes we have to get testicular sperm from the epididymis. ICSI is when we pick the best looking sperm and place it into the egg. Donor sperm, in some cases, with same-sex couples, single mother by choice. Also, in some cases where if the partner, we can't safely get sperm, they have lack of production of sperm, we'll use a sperm donor. Egg donation program is also an important option. We do, since COVID, see some younger women and patients who have premature ovarian insufficiency, which always does feel like, why me? Why did that happen? And it's important to keep an open discussion in terms of the egg donation program. There's sperm freezing and embryo freezing for the future. So some patients say, I'm not ready. I'm not ready to be pregnant right now. I want to keep my options open for the future. So sometimes we think of egg, sperm, or embryo freezing. We'll talk a little bit about assisted hatching. One of my favorite topics is polycystic ovary syndrome because I feel like a lot of the time that is brushed to the side. So it's important to think about that as well. Infertility acupuncture helped me when I was trying to get pregnant. So I always feel that it lowered my cortisol and helped me take, I feel like it improved blood flow and circulation. IUI is where we wash the sperm and place it into the uterus at the time of ovulation. It's important if sperm motility is slow, we can think about IUI, as well as in some cases, IUI is a good option as to see if we can bypass the cervix. If they've had a LEAP or procedure to remove a part of the cervix, the endocervical canal may not be as open and reliable. Next slide. So a lot of people have many questions. We're here for you for those questions. I think fertility lifestyle is in preparation. You feel empowered to. I felt like when I was trying to start to plan for trying to conceive, it helped me to feel like I'm taking the vitamins, I'm exercising every other day. I saw a nutritionist who really made me revamp what I was doing. I didn't realize like a lot of the pitfalls I was doing. And then acupuncture helped a bunch, and also making sure to take time for mindfulness and centering myself. And then I'm happy to when you send the questions, we can answer them through, but I wish you guys all the best, and thank you so much, Sally.
Thank you. It was so great to talk to you, Dr. A. Um, so I love to talk about the importance of your network and making sure that you have collaborative providers, because if your providers don't work together, then that's not supportive for you. If you start out your fertility journey and you go to a fertility clinic, often these fertility clinics do have a lot of providers that they can recommend. So that's the first source that I would go to. But um, something that I saw with a lot of my clientele was that um, people would go to Google and they would find their fertility doctor, and then they go to Google and then they would find their mental health provider, and then they would go to Google and then they would find their acupuncturist. And all this took a lot of time and often was very stressful. So, part of what Matrikas does is creates a robust community throughout the US of providers so that we know each other, so that we can hand each other off to save you time, effort, and energy from going to Google. Another aspect of what happens is that we support your mental and emotional well-being when you're going through this process. As we know, this is a very stressful process sometimes, but if you have collaborative care and you know that you can turn to your provider and you know that they're talking to your other provider because they've handed you off, that you are well taken care of. And if you need to ask questions about nutrition or to find a therapist or anything to do with your journey, you know that they've got your back, which is really great. And this also helps you to make empowered decisions instead of just going to the internet and trying to figure out, a lot of times people are at the top of the list on Google are the ones who paid the most to be there. And we don't know that they're the most competent provider for you specifically or the person that you need. So this is where Matrikas comes in. Next slide. So how would you build your support system? I think that you need to figure out exactly what type of provider you align with very well. I want everyone to have the best care they can. And often this has to do with whether or not you're looking for insurance to take providers that take insurance or whether you want to pay out of pocket. That's definitely an aspect. There's also another aspect of location. How far do you want to travel? What is the likelihood that you could get to that appointment? Or do they do virtual sessions? There's a lot of basic groundwork like that that you want to weed out, but also culturally competent care is very important. You want to find providers that listen to you and that care for you and that you understand and they understand you. So I always suggest that you build the relationships before you're in crisis. You want to have a mental health provider that you already know. You don't want to have to seek out someone when you are already stressed out. So preparation is key, as Dr. A discussed about preparing before conception. It's the same, not just physically, but also mentally, and finding your providers. It's a lot easier to scope out providers before you're actively in this, oh no, what's happening? We need to get this fixed. I suggest to start shopping around before you're actively trying to conceive to see who you have in your pocket and start building those relationships with those people. Um, I think it's a very good idea to have a support system around you that are professionals, but also peers. We don't necessarily need to lean on our friends for everything, but you do need to have people around you who understand the journey and know what's going on. And always ask for help without any shame, because there's no shame in getting the help for what you need. I'm a very big advocate of community, obviously. So when you have community, that dispels a lot of the shame, a lot of self-judgment, and it also dispels isolation. Next slide. So I'll tell you a little bit about how I got started forming Matrikas. I was a prenatal massage therapist for 26 years, and I saw pregnant clients primarily, and then I started seeing pregnant clients and postpartum clients, and then I started seeing clients who maybe I had worked with through a couple of pregnancies, and they were having a secondary infertility. And so that led me to start working more with fertility clients um, because the spectrum is not just one aspect, it really is a reproductive health spectrum. And I realized that I needed to know providers for everyone. And so I started working a little bit more closely with fertility doctors in a lot of the fertility clinics. And fertility doctors, I always say this, are some of my favorite people because of the innovation that goes with fertility and how fast everything's been going the last few years and how innovation is going. I always think these doctors are very open-minded and very supportive of multiple modalities. So we are a national community of providers for reproductive health support. So we have providers who see clients and patients everywhere from preconception through menopause. We connect fertility, pregnancy, and postpartum providers together so that we build real relationships so that we can transfer patients and clients to each other and feel that we know who we're handing off to and that they are going to get collaborative care. And we're not just sending people out into the Google void to find something on their own, and they're going to end up buying some crazy product that promises you something and doesn't get anything. Um, we are focused on real relationships and not just referrals. So there are a lot of lists of directories. And when I was a massage therapist, I was on a lot of directories and a lot of lists. And I found that that's basically just like being on Google. So we are focused at Matrikas on building real relationships so that we know how to competently hand off clients and patients to each other. Next slide, please. So that's who we are. Do we have another slide? Let's go to the next slide. I think we might be at the end of it. Yeah. And then there's the fantastic SCRC team. So if you have any questions, I'm happy to answer them. So we don't have any open que or am I correct? We don't have any open questions right now.
No, there are no questions right now.
Okay, cool. All right. So thank you all for joining us. That was a really great and informative program from Dr. A and SCRC. And thank you all so much for having me. I really appreciate it.